So today's topic is all about back to school immune health, and we're going to be talking about a number of different things that you need to be concerned with as we go back into school. And so, again, I'm going to give you just a few minutes to type in. Let me know that you can hear me. Again, we're rebooting from a technical difficulty, and just want to make sure I'm not talking to myself. What a fun Friday that would be. So if you can hear me, go ahead and plug it in and let me know that, that I'm coming in loud and clear. All righty. Looks like we're back. Okay, good deal. So where do we end off? We were talking about going back to school, and we were talking about communicable spreading of germs. And that's one of the biggest issues and one of the biggest things that can happen to adults, not just children. The children go off, they grab the germs, they bring them back to their families, and then their families spread them amongst the community. So we get this mass spreading of communicable germs. And then what happens as the fall is approaching, the days get shorter. But not only that, our capacity to get out into the sun is diminished because we're in school, right? So the kids are not getting the sunshine. So their vitamin D levels are starting to drop. Vitamin D deficiency and this time of the year is actually associated with cold and flu season on purpose. It's because the vitamin D levels drop. If we look at cold and flu season in the southern hemisphere, it coincides with their fall as well. And all that correlates to lower vitamin D capacity. And again, one of the reasons why we're going to see that is kids are just not outside as much. The summer's over and they're in school, indoors for 8+ hours, being exposed to all kinds of germs, but then they don't have the vitamin D production. And remember what vitamin D is important for. It's important for immune system regulation. So we get sicker kids being exposed to more germs all at the same time. Then we get those kids sharing those germs to parents, and then parents going on to work and sharing those germs with coworkers. So again, mass communicable germ infiltration and less vitamin D from an immune perspective to deal with it. So these are, again, these can be very, very big problems. So it's not just a couple that with, okay, not only are kids going inside and getting less sun exposure, but they're getting more screen time. A lot of schools have gone away from books and they're kind of more involved now with the screens. So you've got either computers or you've got some type of laptop or some type of device or personal device where the kids are, now their eyes are being bombarded with the blue light. They're also sitting in front of that screen a lot more than maybe what they were in the summer. And so what that's leading to is it's leading to disruption of brain biochemistry through the exposure to UV light, or not UV light, but to blue lights. But it's also leading to more sitting. So they're sitting and they're not as active. And remember that one of the most successful ways we can improve our immune system is activity, is movement. And one of the reasons why is our lymphatic system is pumped through motion and movement. Remember, your blood has a heart to pump it, but your lymphatic system doesn't. Your lymphatic system is pumped by movement. And what is the lymphatic system? It's the system that helps us to detoxify, but it also is the system that helps immune cells get around to where they're supposed to go so that our immune system is capable of defending us from environmental threats. And so if we're sitting for long periods of time, our lymphatic flow is diminished. And as our lymphatic flow is diminished again, so is our immune system. So the chronic sitting, the lack of sunlight exposure, the increase in screen time, the sharing and infiltration of more germs, all that kind of leads to this confluence of diminishment of immune function in the presence of germs, which then opens us up to developing illnesses. So all that's pretty important to understand. So how do we combat it, right? I mean, what do you actually do to combat all of those different elements? Well, the first thing that you want to think about is what can you do before school starts to get the immune system to a position of strength and to a position of maximum power, so to speak, so that it is less susceptible to this issue. Now, one of the things I like to recommend before going back to school is something called vitamin D therapy. Now, vitamin D therapy has been around a really long time. It's quite safe to do. And one of the things that we want to do is we want to take doses of vitamin D that match our body weight for several days to increase our vitamin D levels because we're going to be getting less sunshine. So we remember, if you've ever been to the doctor and they have tested your vitamin D levels, which I do recommend that you get that done coming into the school year, coming into the beginning of the school year, you want your vitamin D level to be somewhere between 70 and 100. That's ideal. If you can keep your vitamin D level between 70 and 100, that's going to put you and your immune system in a position of strength. So in order to get an immune boost from vitamin D, we can do a therapy. Now, what is a therapy? A vitamin D therapy, it works like this. You take your body weight in pounds, so whatever that is. So if you weigh 100 pounds, you're going to take 1,000 units of vitamin D per pound of body weight. So this works for kids as well as adults. So a 100-pound adult would take 100,000 units of vitamin D every day for 3 days. And that is enough to boost those vitamin D levels up to help get that immune support that a person needs. So vitamin D therapy is done by taking 1,000 units of D per pound of body weight for the individual. Now, there are a few caveats to this. If you have active kidney disease, you don't want to do this because vitamin D is going to increase your absorption of calcium. And if you've got kidney dysfunction, it can actually create some life-threatening problems with calcium toxicity. So if you've got kidney failure, if you're on dialysis, if you've got certain autoimmune diseases that we know can affect or impact some of these soft tissue autoimmune diseases that we know can impact the kidney function, this is not for you. So warning, if you've got kidney disease, kidney failure, you do not want to use vitamin D therapy. It is not safe if you have those conditions. Now, again, it's always a good place to start from a position of knowledge, which is if you go to your doctor, ask for a blood test. And what is the blood test that you can get done that will, let's see here. The blood test that you can get done is called a 25 dihydroxy vitamin D or 25 OHD test, putting that in for you. So that's the test that you can ask for. And again, you want your level to be between 70 and 100. And if your level is between 70 and 100, there's probably going to be a limited benefit to doing the vitamin D therapy, but you can do vitamin D therapy. It's pennies to do this type of therapy, but it's extremely effective. Now, the other time I might recommend this therapy is when somebody comes down with a cold or a flu. So the first sign of a cold or a flu, we can do high-dose vitamin D therapy for 3 days. And oftentimes what that does is supports the immune system strong enough that cold and flu tends to go away much faster than it would otherwise go away. So this is one of the nutrients very, very critical for immune function and for immune cells to properly work. And so if you're low in vitamin D and you're going into the school year and you're now disadvantaged because of less sunshine and less vitamin D production through the skin, this therapy can work extremely well to get you some great support. Now, one of the other therapies that I recommend for building immune system function back in as we're going back to school is high doses of vitamin C. And when I say high doses, depending on your age and weight, 3 to 5 grams of vitamin C for several weeks preceding up to the back to school period to boost your level of vitamin C in your bloodstream, support your immune system. If you wait till you get sick, it's like the thing, it's like it's too late. Although you can still use vitamin C to overcome a cold or a flu faster, it's best to take it prophylactically as you're going into the school year, getting ready to start school, so that you support your immune system's capacity, again, to fight all those germs that you're going to be exposed to. So 3 to 5 grams of vitamin C, in some cases more. You got to be careful with vitamin C, those of you following a gluten-free diet, those of you trying to avoid GMO, because most vitamin C's in the U.S. are produced from genetically modified corn. So the source of the vitamin C is very, very important. What I would recommend, the product that I recommend that you use, and use it in a powder form because it's a lot more effective if you use it in the powder. It's called Detox C. You can find that on the glutenfreesociety.org website, but it's an excellent, excellent non-GMO, organic sourced vitamin C. And if you're needing something, don't go buy the over-the-counter, from the local pharmacy, just the vitamin C powdered products, unless you want to get exposure to GMO corn. And again, you can't get healthy eating things that are not healthy, and you don't want to start from the premise of trying to support your immune system by taking something that's not good for you. So vitamin C is very, very effective, 3 to 5 grams a day as an immune booster as you're going in to begin to start the school year. So those are very, very 2 key nutrients that can be quite helpful. Now, another one is zinc. Zinc can be extremely strong. Now, what you can do is look at your fingernails. So when you look at your fingernails, the surface of the nail itself will oftentimes, and this is not so true in kids as much as it is in adults, and I'll explain why. There's little white spots that can form on the nails, and it's on the nails. It's not like an injury, like you drop something on the nail and it turns white. It's actually white spots within the nail. For growing children, this is pretty normal because when children are growing, they're using up more zinc, they're using up more of the minerals for that growth, and so the nails will show those white spots as a result. Doesn't necessarily mean that the kids are deficient in the mineral, but with an adult where the growth is no longer occurring, we're going to see the same white spots that can occur, and this in an adult is oftentimes indicative of a zinc deficiency. So if you're seeing these white spots in your nail beds, and you're coming into cold and flu season, coming into the new school year, you want to take zinc supplementally. And my advice would be to take between 50 and 100 milligrams of zinc, combine that with 3 to 5 grams of vitamin C, and potentially combine that with a 3-day stint of high-dose vitamin D therapy. All these things are kind of think of it as the arsenal of nutrients that your immune system is going to need to support you as you're being exposed to more and more of these different types of germs. So can be very, very effective. And oftentimes I use that very same protocol in my practice, and we see people recovering much, much faster when a cold or a flu hits them with those particular therapies. So you can also use those prophylactically, meaning you can use them preemptively before the school year to get your immune system in a much more favorable position. So all those things being said, what else can we do to prepare our children for this? One is we need to make sure they're involved in some type of activity, because if they're going to school and they're sitting for 7 or 8 hours a day, most schools nowadays, the recess is very limited, the gym time is very limited. So if they're not involved in some type of sports program, through the school, then they're probably going to be sitting far too much over the course of the day. So number of things that we can do before or after school. One is enroll them in some type of physical activity program, whatever they like to do. My advice is get them in something they love to do that they're going to have fun doing. And it doesn't even have to be organized sports. It could be just making sure they're going outside and playing. What oftentimes happens when the school year starts is a lot of kids are basically shoveled from school back home, and then it's homework all night, right? So they're sitting down the entire day. There's very little exercise because all the emphasis is on learning. It's all the emphasis is on is on studies, right? And this is part of the balance that can be, well, let me rephrase that. This is part of how life can become very imbalanced. When your children are having to be intellectually focused 8 hours at school, and then they have 2 to 3 hours of homework to do when they get home, that's a huge imbalance. And studies have shown that children who are physically active are smarter. Children who are physically active have higher grades, have higher academic performance. So you don't want, and as I know, and that's kind of the opposite of the way most public school systems work today. So again, you want to have some type of element where your children are either, you're mandating that they go outside and play and getting away from the screens, getting some sunshine when they're outside, or that you have them involved in some type of organized sport where they're guaranteed a certain amount of activity on a daily basis, because otherwise their bodies and their muscles are going to atrophy and deteriorate through the course of the school year. And this is actually a quite common scenario that happens to kids. And it's one of the reasons why we'll start to really see colds and flus knocking people out in December as well, because now, school's typically starting late August. And then we've got a couple of months of sitting and no sunshine. And so we've got kids whose muscles are atrophying, whose sunlight exposure is diminished. and they're sitting all day long, and they're being exposed to blue light all day long, so it's disrupting circadian patterns and sleep patterns, and we're basically positioning them for winter illness. That's what it is. It's positioning them for winter illness. So let's plan against it, and let's be preventative, and we can offset a lot of that. So one of the things that I like to see parents do is exercise with their kids. Do it with them, because then you're setting the example. Don't just tell them to do it while you're not doing it. So exercising with your kids can be an important thing to do. But again, if sometimes they're involved in organized sports, they're getting enough, so you don't necessarily have to do that with them. So very, very important, though, that you have it, that it's programmed into their day as one of the fundamental things that is the most important for them to maintain their health for the rest of their life. Because many times what happens is when school starts, parents say, you know what, exercise, we don't have time for it. We've got too much homework. You've got to make time for it, and you've got to prioritize it, because if you don't, you're going to set your children up for all kinds of diseases in the future: diabetes, obesity, heart disease, cancers, autoimmune conditions. So you've got to pre-program it in early. If you're not pre-programming it in early, they're not going to know what to do when they get older and sicker. So program it in early, and now's the time. Don't let that back to school take away from the importance of exercise. Don't let that back to school put them in a chair for so many hours of the day that their muscles start to atrophy and their immune systems start to falter. Because remember, your muscles are a reserve system for your immune tank. Your muscles are a reserve bank for your immune system. So if you have muscle atrophy, you don't have as much immune power to pull from. So again, it's important to keep those kids exercising to maintain a strong immune system. And we've lost our way, especially in the United States, we've lost our way because we overemphasize academia over physical sports. And we need to keep our kids active. That doesn't mean they have to go and join the football team. It doesn't mean they have to go join the soccer team, but something they enjoy doing that keeps them physically active is very critical for their development, very critical for their immune system function. So let's see here. Got a question coming up here. Debbie's asking, I wanted to get a multivitamin on Gluten-Free Society while buying the detox seed. Does the manganese in your multivitamin contain nickel? No, there's no nickel in our multivitamin. Good question. Let's see here. Marianne is asking, how long do you do this for? I'm assuming she means maybe the vitamin D therapy. It's a 3-day therapy. You can do it as long as 9 days, but so if you're going to do it for the 9-day stint, here's where I'd have somebody do it for 9 days versus 3. Is if their vitamin D levels when we measure them are below 30, I'm going to have them do the 9-day stint. So here's what the 9-day stint looks like. It's body weight in international units. So if you're, again, 100 pounds, you take 1,000 IU per pound of body weight. So if you're 100 pounds, you take 100,000 international units of vitamin D for 3 days in a row. Then the next 3 days, you cut that in half. You cut the dose in half. You take 50,000 international units for 3 days in a row. And then the next day, you cut it in half again and take 25,000 international units for 3 days in a row. So no longer than 9 days. You don't need to do it longer than that. And again, the kidney dysfunction, it's contraindicated for anyone with kidney disease or major kidney problems. So if you're on dialysis, don't do vitamin D therapy. Again, if you've got a diagnosis of kidney failure, don't do vitamin D therapy. So, and keep that at the forefront, because I had a patient one time come to me from another doctor where they were doing higher dose of vitamin D, and it was shutting down that patient's kidney and causing calcium toxicity. And so it can be life-threatening. So keep that in mind. Okay. Let's see here. Chris and Mindy Bennett, quick question. Last week I spoke about gallbladder removal, importance of taking digestive enzymes. Is there a good brand name enzyme that is more widely available that I could recommend to a friend? The one I recommend, and it's widely available anywhere in the world, is called Ultra Digest GB. GB stands for gallbladder. So that is available through glutenfreesociety.org, and it can be pushed out or shipped out anywhere internationally as well. So widely available, but you do have to order it online. Ultra Digest GB. It's designed to support people who don't have a gallbladder digest fat much more effectively. Good question. Okay, so The next thing I wanted to talk about is another factor that we have to worry about with our children when they're going back to school is these backpacks. Now, some schools are going away from textbooks more to digital, but not all of them are. And what we're seeing is kids get like loaded up with books, right? And then we get these big backpacks and we take, a 50 to 80 pound child and we put 25, 30 pounds of books on their back and expect that that's okay. And what that does is depending on depending on the type of backpack they have, two, depending on how they wear their backpack, it can create a lot of strain in the back. And so again, now we're creating strain in the back, plus we're making them sit all day long. And that, you realize that when you sit, you double the pressure on your spine. And when you throw that backpack on as well, you put the spine under stress and trauma. And so that in and of itself can lead to injury. And I've seen a number of children with back pain problems as a result of these big, heavy backpacks. So you want to position your child for success by allocating the weight of their backpacks. Don't overwhelm them, especially if they're walking to school. And so one of the things you might want to consider is a backpack that has a pull handle with a wheel set on the bottom of it so that if it is heavy, they can roll it instead of having to carry it. Because that in and of itself, I've seen that do a number on children. And remember that, part of my background in my training is as a chiropractor. So the spine in and of itself is the mediator to how the nerves come out and feed our organs. So if you are under stress and duress from a heavy backpack, if you're sitting with a forward posture all day long, and what you're doing is you're compressing the nerves that feed the lungs, but you're also compressing the lungs physically by leaning forward, looking at a screen. So some studies show that you get up to 20 to 40% reduction in lung filling capacity in that school desk. And so what happens with that is now we have diminished oxygen. And that diminished oxygen, remember, all of your muscles require oxygen to generate energy. Your brain requires oxygen. So we don't want to see kids with diminished oxygen. That also will suppress the immune system. Oxygen is one of the rate-limiting factors that are necessary for energy production and for immune health. So we don't want to diminish their capacity to breathe. So you might also consider teaching your child to sit up straight in the desk so that the chest is open and out and they can fill their lungs, as opposed to sitting forward looking at that screen where they're not getting that adequate oxygen filling of the lungs. So very, very important. Let's see here. Carla, just learned that I am deficient in vitamin C. Will do this for sure. Okay, yeah, good, Carla. Yeah, it's 3 to 5 grams a day should cover it. Now, I'm glad you chimed in, because there's another strategy for vitamin C deficiency, and it's very similar to that vitamin D load, or that vitamin D therapy, where you're taking higher doses for a short period of time. You can do the same thing with vitamin C. This protocol was developed by some of the smartest minds in orthomolecular medicine. It's called a vitamin C flush. And what happens, the way you would do this is you would take, of the vitamin C powder, you would take 2 teaspoons. If it's pure ascorbate powder, which, if you're using my Detox C, it is. It's manufactured very, very specifically under a nitrogen blanket to retain its antioxidant properties, because most vitamin C's over the counter are garbage. They're already oxidized, so taking them does more damage than help. So anyway, you're taking a teaspoon, 2 teaspoons actually, of powdered ascorbate, and you're mixing it into 3 to 4 ounces of water and stirring it really well and drinking that. And you do that every 15 minutes. Now, let me back up a minute. Before doing a detox, what I call a detox C flush, because that's what's going to happen. We're going to flush out your bowel. You want to do this on a day where you're not doing anything else. So like, don't do this before you go to school. Don't do this before you go to work. Do this on a Saturday or Sunday where you got nothing going on, because it's going to take about 4 hours to get through it. So you do this on an empty stomach as well, because we're going to be pushing everything out of you. So we're going to be fasted when you're doing this, so that you're not just taking that breakfast that you just ate and just causing it to come right out of you. So it's 2 teaspoons of vitamin C powder mixed in 3 to 4 ounces of water every 15 minutes until you have a watery stool. And what happens is that what that's setting up is it's calibrating what your vitamin C limit is, because by the time you hit a watery stool, that's bowel tolerance, meaning you've taken so much vitamin C that your bowel can no longer tolerate it, and all that water that vitamin C pulled into your bowel it's flushing out. So generally speaking, once we know what our bowel tolerance for vitamin C is, let's just say it's 20 grams. It took you 20 grams to do a flush. You can take 50 to 75% of 20, right? So that would be 10 to 17 and a half grams of vitamin C a day, right? For several days, up to a week at a time, to saturate your system with vitamin C and help support your immune function. So that's one way, if you're really severely deficient in vitamin C, to really get your level up quick. Now, with a vitamin C flush, if you have an ulcer or if you have like a hemorrhoid, like a rectal hemorrhoid or an anal hemorrhoid, it will burn. So it's not you're not a candidate for doing that until that hemorrhoid clears. So just make sure you're not taking a bunch of ascorbate, because it'll irritate the hemorrhoid. It will burn it and it will hurt it. Okay. Let's see here. Carla, I'll answer your second question. I live in Houston. Do you still see new patients? Yeah, we do. Takes a few months to get in, but we do. We see people new all the time. So get that appointment as quickly as you can if you want to get in, because it's going to take a while for that to happen. Okay, next question. My daughter, Kayla's asking, my daughter is in volleyball, but I have to harass her teachers on a daily basis to keep her on A's. It's slightly frustrating. I don't know. What does that mean, to keep her on A's? Maybe chime back in on that one, Kayla. I'm not sure if I get it. Maybe there's no question in that, but I don't know. Again, I'm not sure. I'm not quite sure what that means. Okay. So here we are. We're talking about, again, the summary of what is it that we can do for not only our children but ourselves to build our immunity so that we're less susceptible to the sharing and the communicable diseases that are going to start going around. But I want to talk about another topic that I think is very critical. And the reason why I want to talk about it, and I'm not talking about this in the sense that I want people to make decisions based on just me talking about it today. This is something that requires some thought. But the topic of vaccines, doesn't matter where you are in life. If you're being told, okay, your child needs vaccines to go to school. Now, some states, like in California, they mandate it. In my opinion, it's a travesty that you could mandate having to force inject somebody, but they've done it there in that state. But if you're not in that state and you're in any other place in the world, well, particularly in the U.S., that you have the right to decline any form of medical treatment, including vaccines. So some people, that's one of the things they do is going back to school is they take their child into the pediatrician and they update their vaccine schedule. And so I would just have some commentary on that. Number one is, flu shots don't work and they're worthless. Don't waste your time. Now, I know I'm being very contradictory when I say that, and a lot of people call me crazy and a quack just by the nature of saying that, but it's true. Even if you look at the manufacturer and what they say on the package, they're going to tell you that they can't predict what strain of the virus is going to be out this year. So I'm not a big fan of those. I actually worked in a family practice clinic when I was going through graduate school, and what we'd see the mass influx of people coming in to get their flu shot, and then 2 to 3 weeks later, we'd see them coming back with the flu. Now, I know that many will say, well, you don't get the flu from the flu shot because it's not a live vaccine. That's not what we saw in the clinic. I don't care what anyone says. I can just tell you what my experiences are, both from my graduate school training, but also in my practice, is that when people get the flu shot, they oftentimes come back with the flu. And there are several reasons why that can happen in my estimation. And the first one is that, some of these shots contain mercury, and mercury suppresses the immune system. It's immunotoxic. And so, just by the nature of injecting yourself with something that could be potentially dangerous to your immune system, could suppress it well enough that you would become exposed to a virus and then be able to capture that virus as a result of suppressing your immune system through a treatment. Some of these also contain egg, and many people don't even realize that if they contain egg. I just had a patient a couple of months ago had an egg allergy and had a severe reaction. It's actually one of the reasons they were coming in. They had a severe reaction to the vaccines, and many of them contain egg. And the doctors had never even tested them for egg allergy. So to me, it's, egg is one of the top 8 allergens in the world. And if you're going to consider any vaccine at all, my advice is you need to be tested to make sure that you're not allergic to egg. And there's different ways to test for allergy. One is you can have the doctor run an IgE blood test where they're measuring an acute IgE response to the egg proteins. And so that's one way to get it done to learn about acute. So that's something I would encourage you to do if you're considering vaccinating. You want to make sure at the very least that you're not allergic to the ingredients in the vaccine itself. So having your doctor test you before just saying yes would be a really smart thing, because it's been my experience that people who are allergic to some of those adjuvant agents in the vaccines, they have some of the worst responses. And those are the ones that end up, becoming ill or becoming sick as a result. So, keep those things in mind with your kids. Egg is a really common allergen, and a pediatrician should be easily be able to test your child for egg allergy of an acute nature. You can also do delayed allergy testing, and the pediatrician should be well educated on that as well. And if they're not, you might want to find a doctor who will do allergy testing first, so that you can have that information to take to the pediatrician to either have them, basically cross-reference the ingredients from what your child is allergic to versus what's in the vaccine, so that you don't do anything that would potentially harm your child. Because once the damage is done, it's done. And, again, many of you might believe strongly in vaccines. This is not a conversation to damn all vaccines. This is a conversation to say, look, informed consent. Have the foregoing knowledge of what you're putting in your body before you just do it. And I've seen a number of kids, and one of the other vaccines that before school that is commonly given is the Gardasil, which is for human papillomavirus or HPV. And I have seen more patients have adverse reactions to this particular vaccine, in my experience, more than any other form of vaccine. I've seen patients who were completely normal go into complete neurological meltdown, and in some cases, some of them got so sick they were out of school for a month or 2 months because of the illness that was caused by the vaccine injury. So again, it's informed consent. It's knowing, and that right now there's an event online that I would encourage any of you who are kind of on the fence about vaccines, or maybe you do get them and you want to know more information, or maybe you don't get them and you need to be you want to come from a place of greater information and informed knowledge, and it's called The Truth About Vaccines, TTAV for short. And I'll put a link up here in a little bit for that, so that you can check that out. But it's a free online event. It doesn't cost anything to watch it, and it has some of the world's leading immunologists and physicians and experts on vaccine science, discussing the pros and cons and the risks associated with vaccine, because there are very real risks that you may want to be considering with your children. And so don't just go into this without knowing that or understanding it. It's just that important that you understand it. So I'll post that link up here in just a moment. Okay, let's see here. Okay. What to do in chronic fatigue syndrome with issues mostly on the nervous system? So that's a big question, Xavier. Chronic fatigue syndrome, if it's even an accurate diagnosis, there are a lot of things. Where I would start are the fundamentals. The 4 fundamentals of investigation for chronic fatigue syndrome would be: rule out infection, rule out vitamin and mineral deficiency. You want to rule out any type of environmental chemical exposure that you could be getting, from air, water, or other sources. And you also want to make sure that you're ruling out any type of food allergy. And the reason you rule those 4 things out is because those are all controllable. You can control your air quality, your water quality, you can control your food, you can control your chemical exposures. And if you do have an infection, you can visit a doctor and have that appropriately treated. So those things are important triggers for chronic fatigue syndrome. and start with those things first. And if you don't feel better after you've started with those things, then you can have it, hopefully get with a functional medicine doctor who can dive in deep and try to help you find the origin. In my experience, most cases of chronic fatigue are actually induced as a result of one of those four things. But every once in a while, we'll get somebody with sick building syndrome who's got chronic mold exposure. Every once in a while, we'll see somebody with heavy metal toxicity, so maybe like mercury or lead or cadmium toxicities. Those can be quite disruptive to human biochemistry and create a major problem. So, again, I would just encourage you first and foremost to investigate those things and then move on from there. Let's see here. It's funny, somebody asks a question and somebody else chimes in. So Dina is saying, yes, I have CF chronic fatigue syndrome too, and it's I'm assuming an accurate diagnosis. So Dina, the same pieces of advice would apply to you as well. And maybe you're already doing those things, but thanks for chiming in. Nick, if I have nieces that are getting vaccines, particularly the live virus vaccines, do I need to be careful with my son if he doesn't get vaccinated? Possibly, yeah. I mean, I would go back and watch the first half of this segment where I talked about high dose vitamin D and zinc and vitamin C as a protective or as a prophylactic for immune system support. There's two ways to look at this. Some people will say, well, if your kid doesn't get vaccinated, you're putting my kid at risk. But the opposite is actually true in the case of live vaccines, because if your kid is getting vaccinated and my kid is not, then my kid poses no threat to you, because if vaccines actually work, your kid's vaccinated and therefore is not at risk. But the reality is we know that vaccines, one, they can't be proven to fully work. And again, I'm not condemning everything in terms of vaccines. I think you need to be informed, and both parents need to be making this decision together under the supervision of an intelligent doctor and under a basis of informed consent and knowledge. What are the risks versus the benefits, and the real risks versus the real benefits, not the pseudo risks versus the pseudo benefits. Because a lot of what's out there, a lot of the information in this area is propaganda more than it is medical science. And that's been shown and been proven as well. So anyway, to answer your question, Nick, yeah, I would support your son's immune system, if he's going to hang around a bunch of people who are getting live vaccine. And that's all you can do. That's all you can do. Let's see here. Ivy, related to the vitamin D topic, do you recommend any specific time through the day for sun exposure so as to get enough vitamin D without damaging, and for how long? Yeah, this will change through the course of the year. If you check out the Vitamin D Council, Dr. Hollick, which if you remember, if you tuned into my autoimmune revolution, he was one of the doctors that I had come in and give his expert opinion. But that was Dr. Michael Hollick, but he runs the Vitamin D Council, and they have an app, a phone app you can download. And what it does is you can plug in where you live, and it will tell you the best times of the day to get sun exposure to maximize your vitamin D production. So that is what I would recommend you do, is just go download that vitamin D app from the Vitamin D Council. Okay. Next question. Do you test, Carla's asking, do you do testing of the body for mold? Yeah, there's several ways to test to see whether or not a person is mold reactive. And realize too that mold reactivity could be coming from inside of you. You could have a yeast overgrowth. Yeast is mold. So there are different forms and different species of yeast. There's I've seen patients that have had prior diagnoses of cladosporium infection in their nose, which is a type of mold. I've seen people with candida overgrowths, candida albicans, geotrichum. They're just different forms or species of mold. And sometimes the mold is damaging from the inside, right? So you have an infection per se, and the mold is creating a problem from the inside. And sometimes you live in an environment that's very moist or humid, and you're reacting to the mold and the mold spores Some people are allergic to mold, and so you're breathing those things in. And then sometimes, depending on the type of mold, some certain species of mold can produce what are called mold toxins or mycotoxins. And mycotoxins can generate or rather, molds can generate different forms of mycotoxins. There are a number of different kinds. There's ochratoxin or ochratoxin, depending on how you want to pronounce it. There's gliotoxins, there's trichothecenes, and there's aflatoxins. These are all just different forms of mold toxins, and some of them are found in the food that we eat, particularly grains. The way they're stored and processed typically have high levels of mycotoxin. Other foods do as well, but grain's probably one of the most notorious. Coffee's one of the most notorious for containing mold toxins or mycotoxins. Wines can contain high levels of mycotoxins as well. So if you drink wine every night, that's a potential source of where you might get exposure. But then, so you can get, again, environmental molds producing mycotoxins that you can breathe in. And so, one, you can test the person to see if they have mold overgrowth or mold infection. And so, some doctors will run nasal cultures. Some doctors will run throat or mouth cultures. Some will run tests of the GI tract to isolate and identify mold inside of the GI tract, mold out of control inside the GI tract. Some doctors will run antibody tests to measure to see if somebody has antibodies against certain species of mold. So there's a lot of different ways to do that. And then some doctors will run tests that look at urine levels of mold toxins, not mold itself, but the toxins that mold can produce. So urine testing for mold toxins can be helpful. Other types of tests that can help determine whether or not mold is an issue are just good old-fashioned allergy tests to see if a person is allergic to molds. And then again, in addition, beyond that, you can also have testing that can help you to isolate or identify whether or not you have immune parameters that are common under chronic mold exposure. And so some of those tests are very, very advanced, comprehensive immune tests. One of them is called complement 4A or C4A. Another one is called melanocyte stimulating hormone. Another one is called transforming growth factor beta 1. So those are tests that can give us a little bit of insight as to whether or not we suspect a person might be getting exposure to chronic mold in their environment. So I hope that's helpful. I know I gave you a bunch of stuff to think about there, but it's a very complex topic, and never take mold lightly. But also, if you suspect mold, I mean, that's a big decision, especially if it's coming from your home. And if you're being told to move out of your home, you want to definitely confirm that that's what needs to happen, as opposed to just doing it on a whim of a thought, or maybe maybe I ought to think about moving because I suspect mold. No, you want to confirm that it's there, and you want to confirm not only is it there, but that it's a problem for you as a person struggling with a health issue. And those, again, working with a good functional medicine doctor would be my recommendation, because they should be trained appropriately in trying to ascertain and identify all those different things, because all those moving parts are important. Okay, good question. Sharon's asking, do I need to take vitamin K2 with vitamin D? No. You'll see a lot of formulations over the counter where they add vitamin K and vitamin D. No, you don't have to take one while taking the other. I get all the time where I test my patients for vitamin deficiencies, and they'll be deficient in vitamin D but not in vitamin K, or vice versa. And you don't necessarily have to give them together. It's a good practice in a multivitamin to have them both there together, but it's not a necessity. You don't, in other words, one doesn't require the other, and you don't necessarily create a problem with one over the other by taking one alone. However, if you're going to consider high doses for long periods of time, you definitely will want to have somebody monitoring that. Good question. Gosh, that's a good question, Nick. Which vaccines have I found to be the most important to consider? Honestly, I would say if you're going to consider any of them, again, this is just my opinion, but polio would be the one that I might consider above all the other ones. And not even that polio is a major risk or threat to the people in the United States, although we're seeing with the immigration and the mass influx of immigrants that are not being properly screened in terms of health, we are seeing some of these diseases kick back up. So of all of them, that would be one. But this is an area, again, I would highly recommend. to me, it's not even is one better than another, or is one more dangerous than another. Is it right for the person as a unique individual to consider it? Because there are some patients that are immunocompromised that are absolutely the worst candidate for any type of vaccine because of the adjuvants in the vaccine. You take, for example, somebody who has severe form of autoimmune disease. You don't necessarily want them taking, all those different vaccines because their immune system is already in a state of dysfunction. So those people are really the ones that aren't great candidates for them. But it's hard to answer that question because there's too many individual unique factors that you want to take into play. I can tell you, personally, I choose not to vaccinate my children, and personally, I choose not to vaccinate myself. That doesn't mean I haven't had past vaccinations. I was in the military. They shot me up with more things than you could possibly imagine. When I was young and I didn't know any better, I was served in the first Desert Storm, and they gave me all kinds of things that were probably mysteries. Who knows? I mean, I've seen cases where soldiers were getting vaccinated with all kinds of things, and whether or not they were necessary, it's just standard. It's just what they do, and that it happened to me. I didn't get sick as a result of it. Thank God, and hopefully I won't get sick as a result of it later on in my life. But all you can do is take the individual on a case-by-case basis and ascertain as to whether or not it's the right move for them. And of course, with vaccines, there's two parents, so there's two decision-making heads, and you have to consider the health of the child and any other predispositions the child might have, any other genetic factors of methylation that the child might have, and whether or not there are other people in the family who have reported vaccine injury. All those are just very, very important things to think about. So I wouldn't make a broad spectrum statement and say, do this one, but not that one. Although I would make one. I would say I would not vaccine my young child for any sexually transmitted disease because they're not sexually active. It doesn't make sense to try to vaccinate them for sexually transmitted disease when they're not sexually active. It's just one more assault on the immune system among many other assaults they're going to face with all the other vaccines. Okay, Pam's asking, my daughter just did an intense 31-day advanced maximized living program, which required her to follow a strict ketogenic diet. And the 40th day, she had to have an emergency appendectomy. Could this be related? Boy, Pam, probably not. I just don't have enough information really even to comment intelligently about whether they could be related. I've never seen, and I've used and seen a lot of patients go through ketogenic diets. I've never seen somebody have an appendicitis as a result of being on a ketogenic diet. Typically with appendicitis, what we'll typically see is somebody has pre-existing inflammatory bowel diseases, and they have a weakness in their abdominal, not abdominal, but their intestinal lining or intestinal wall. And they'll be eating a lot of inflammatory foods, or they may be just be coming off of antibiotics, or they may just have picked up an infection. I mean, there are a lot of reasons why, and it's really, I would not, the ketogenic diet would not be even in my top 50 of suspicions as to why she needed an appendectomy, and there are probably other things involved with it more than just that diet. Let's see here, Xavier. I've tested so many things for chronic fatigue syndrome, and I just checked. I have Epstein-Barr and cytomegalovirus. However, how to fight these viruses? I have in mind to use auto vaccines. Do you agree? I don't have any experience with auto vaccines. I can't really comment on that. Homeopathy, I do have experience in that realm, and homeopathic medicines can be quite helpful. What I like to use for virus, somebody's got chronic viruses to support the immune system, I like to use a product called Virid. And the dose on this you got to get it pretty high, but I've seen it work quite well. It's got a number of different, it's a multi-ingredient product that has a number of different things that support the immune system, particularly that support the ability to help the immune system prevent viral replication. So with this particular product, you can pick it up at Gluten Free Society as well. But with this particular one, if you've got, again, depending on how you were tested, because if they tested you for positive for EBV and CMV, did they test you IgG? Did they test you IgA? Did they test you IgM? There are different types of antibodies that tell us different things. But if you've got a chronic infection like that, you could use Vira to support your immune system, but you'd want to take anywhere between 8 and 10 a day for upwards of several months to give your immune system strong support in that. So hopefully that is helpful for you, Xavier. Let's see. Do I think mold is another good reason to avoid grains? I've heard that grains in and of themselves are moldy, and why heavily sprayed with glyphosate. Kathleen, yes, absolutely. Have you read No Grain, No Pain? I talked about this extensively in the book, the mold. It's not just gluten. People think that No Grain, No Pain is just another, sometimes they just think it's another book about gluten. It's not. It's about mold. It's about ATIs. It's about serpenins. It's about all these other things that are found in grain, cadmium, mercury, arsenic, lead. These are all things found in grain that people just don't realize, beyond the fact of some of them being genetically modified, beyond the fact of some of them being double dosed with glyphosate, beyond the fact of the atrazine use and all the other things that are involved in grain production. It's more deep than just gluten, but mold is definitely one of those reasons, but more particularly mycotoxins are one of those reasons. So if you haven't read it, go back and read No Grain, No Pain, because you'll learn as to why the message is not no gluten, no pain. It's no grain, no pain. And I want you to understand that and all of the reasons as to why. Now, you also reminded me to bring up another point about children going back to school. So trying to bring this back to the topic of today's conversation, which is, what is one of the other risk factors that we see in kids going back to school? It's that many of our school buildings are old and moldy. As a matter of fact, here where I live in Texas, in the greater Houston area, there are particular school districts where some of the buildings, they know they have mold in them and they're slated for demolition because of the mold levels, but they're not being torn down. They're basically, they're trying to get the most use out of these buildings as they can, I guess, from a taxpayer dollar perspective. But a lot of kids go to school and they get chronic mold exposure. And I see a lot of very sick teachers getting chronic mold exposure as well, because they're in a building all day long breathing mold and mycotoxins. And so, it's moldy buildings. And actually here locally, Fox in Houston, Fox did a big story on this. Actually, I did an interview with Fox, and several of my patients who were sick from mold came in and talked about how it was the schoolhouses that were making them sick. So again, going back to the children going back to school, if your child is going back to school and you've done everything to support their immune system and they're relatively healthy, but when school starts, if they're starting to be tired and lethargic and they're developing upper respiratory infections and developing all these problems with asthma, you might consider that mold is a possibility in your child's school as well. So Kathleen, thanks for bringing mold up, even though that wasn't the nature of how you brought it. It helped me bring that topic to light. Okay. Harry Costello, should you avoid vitamin K2 if you're on blood thinners? Yeah, you should. You should if you're on blood thinners. Okay, Harry, this is a big question because, first of all, why are you on blood thinners? Now, that's a rhetorical question, right? When a person's on blood thinners, it's typically because they've had a stroke or a heart attack, and the doctor's trying to thin the blood to prevent a second event that might kill them. And so, from that perspective, if you're on blood thinners for that reason, you need to be under the care of that doctor, and you need to kind of follow what he's saying. But what I would ask that doctor to do, and if most doctors who put you on blood thinners are doing this already, is run your aggregation time. So your platelets, looking at your platelets and looking at your prothrombin time and your INR. These are numbers that are measured to try to help determine how clotty or thick your blood is. But one of the best ways to keep the blood thin naturally, right? Because your blood should be thin naturally. If your blood is so thick that you're requiring a blood thinner, then your diet is highly inflammatory. So the bigger question is, what are you doing in your diet that's leading to hypercoagulable blood that's causing an increased risk for stroke or coronary events or infarction-based events, and that is, are you eating inflammatory foods? There are a lot of different inflammatory foods, but one of them that we know can cause, the blood to clot in a hyper fashion is hydrogenated oil, hydrogenated fats, one of the worst things you can eat. So if you see on the food label partially hydrogenated or hydrogenated, you want to avoid that at all costs. Other foods that are highly inflammatory, grains are highly inflammatory, dairy, modern processed dairy, highly inflammatory, sugar, highly inflammatory. And then there's the whole one man's food is another man's poison adage. So, you've got food that a person could be allergic to or reactive to that may be generally a healthy food, but for that person isn't. Those are all things to consider. The other thing you have to consider is whether or not you're getting enough omega-3 fatty acids in your diet, because omega-3 fatty acids naturally keep the blood thin. So if your omega-3 levels are deficient, your blood could become thick as a result, and that can increase your risk for heart disease. That's why omega-3 are considered heart healthy, because they help thin the blood naturally. So knowing what your omega-3 status is would be one of the things I would ask my doctor to test if I were being put on a drug that was a clotting drug, or an anti-clotting drug rather. And then I would also be looking at my vitamin E. I'd looking at my vitamin C. I'd be looking at my selenium status, because these nutrients are also all important in blood thinning. So is magnesium. Magnesium is a known agent that prevents platelet aggregation. So it prevents your platelets from being too sticky and clumping together too easy, which again, that's what clotting is, right? So magnesium deficiency can create increased coagulability of the blood. So looking at those nutrients and looking at your diet and ruling out inflammatory foods, all that's important. So more important than the question that you asked, and that is, should you avoid vitamin K if you're on blood thinners? I think the bigger question is, why do you need to be on blood thinners? So ask a different question, Harry, and I hope that's helpful for you. Okay, so I recently got a yeast infection, and that hasn't happened to me since I was a teenager. It has not been fun. I think I took too many vitamins, and also my urine has been burning. I don't know that too many vitamins would create a yeast infection. I've not ever seen that be the case. Where I see, depending on the type of yeast infection, a lot of times sexual intercourse, if men, when they have a yeast infection, they're non-symptomatic typically. And they can have, a yeast infection in the penis, in the urethra, and they can spread that to a woman even though they don't have symptoms. And so women can pick up a yeast infection from sexual intercourse. And I've seen that. I've seen yeast infections get tossed back and forth because of sexual intercourse between a couple, between several couples actually. So that would be a consideration more than I think taking too many vitamins would be. But for a yeast overgrowth, one of the best things to do is to take a very, very strong probiotic. You want to look for something that has about 200 billion plus colony forming units. I recommend Ultrabiotic Defense as a probiotic that can be used for this. Again, that's available on Gluten Free Society. The other thing that I would recommend is something that helps to support the immune system from a yeast overgrowth is something called Yeast Shield, and that is that's also available in the same place. So those things can be very, very, very helpful. Okay. Oh, Donna, thank you for your. Oh, thank you, Donna. You're welcome. It was my pleasure to serve. I was happy to do it. Help me grow up and become a man. Let's see here. Donna's chiming in again. I went through a vitamin D, C, Virid protocol. So that's the protocol described earlier. Last month, when I realized I was coming down with a respiratory thing, and it worked great. A recent blood test shows that my vitamin D is now 108, a little over the optimal range. Other than knowing I don't need any more vitamin D at the moment, is there any problem with that? Do D levels in the blood change very quickly? Is there any problem with being out in the sun because of this? I'm not worried, but thought it was worth asking. No, it's a great question. No, there's no risk of getting out in the sun. So what's great about your skin is it has the ability to to regulate vitamin D production. And remember that active vitamin D is also regulated by your liver and kidney. So the conversion of vitamin D can be regulated through your internal organs as well. So there's no real risk if your vitamin D, if you've done therapy and your vitamin D is over 100, to go out in the sun. There's no risk of being in the sun and that creating more of a toxicity of vitamin D. As a matter of fact, your level at 108 is not a toxicity, even though it's over the range. The typical lab range on a lab test, depending on which lab you use, is anywhere from 20 to 100 and 30 to 100 and 108. Some doctors might be alarmed by that because they've been undereducated on nutrition. They've been told that that vitamin D, because it's fat soluble, is highly toxic. That's not true. Vitamin D has a lower toxicity value than water. You're more likely to drown from drinking too much water than you are from vitamin D toxicity. Again, unless you have kidney disease or kidney failure. So good question. No danger. You just don't need to continue to supplement with vitamin D. My advice to you, if it's that high at this time of the year, is have it rechecked sometime in December, which is, as the days get shorter over the next month and as your sunlight exposure potentially diminishes over the next month or two. Knowing where you're going to be in December and positioning yourself for potentially another vitamin D booster as you go into January, because we see a rapid increase in January. In the months of January, we see more colds, more flus happening during that time of the year. And that's generally, again, it coincides with as vitamin D levels start to drop. Okay. Carla is chiming in. Do you do testing for autoimmune disorders? I can. My clinic, my focus is not, we don't treat disease. I know this sounds kind of contradictory, but I'm not a medical doctor. I don't treat disease. I don't diagnose disease. We ascertain the underlying origin of why the body's broken. And so autoimmune conditions have 4 underlying pinning reasons. And that's what we look for. We look for the 4 underlying reasons as to why autoimmune disease can begin in the first place. Giving it a name, in my opinion, and identifying rheumatoid arthritis versus lupus versus scleroderma versus Hashimoto's, none of that really is important. What's important is understanding where the body is breaking down and how we can change and modify our behaviors so that we can give our body what it needs to actually heal, because everyone has within their body has the power. I mean, I'm a Christian, but God gives your body the ability to heal itself. You just have to remove the interference. And the most common interference factors are poor nutrition, chemical exposures, infectious diseases that are there that haven't been quite or properly identified. And then beyond that, we look at vitamin and mineral deficiency. And then beyond that, we can look at emotional factors or spiritual factors, too much stress, the wrong relationships. These are all important triggers. So to me, it's less important identifying what to call a disease, and it's more important identifying the underlying reason as to why a disease might exist in the first place. And so understand that every disease, no matter what it is, every chronic disease is not, I know I'm going to get off tangent, but I think it's an important topic to discuss. Every chronic degenerative disease is nothing more, and this is my opinion, is nothing more than your body trying to adapt to your poor choices. So if you have behaviors that are not healthy for your genetics, your body will try to warn you by expressing that warning in some way. And that way is typically symptoms, right? Symptoms or syndromes in which doctors generally tend to diagnose, and then the diagnosis sets up the stage for treatment. And the treatment is usually some type of pill, some type of surgery. Chemical manipulation using drugs does not fix why the problem is there. The problem doesn't exist because a person has a chemical deficiency. The problem exists because the person has a lifestyle deficiency. And if we can isolate and identify what those are in a person, then their body has the natural innate ability to heal itself. So I think that's a point of clarity. When I talk about, patients and I talk about my clinic, I'm not doing any treatment. I'm not doing any diagnosis. We're just taking people and we're plugging in the right set of lifestyle behaviors so that their life can change and their body has the ability to heal. It's a completely different paradigm shift, and it's not what most people think of as medicine. Most people think of, they go to the doctor, you get a medicine. And that, how well has that worked? Look around. We have sicker people than we've ever had, and we have more drugs in use than we've ever had. And if the drugs were effective at alleviating or actually curing the disease, then we wouldn't have much disease. But the fact of the matter is we're using more drugs than we ever have, and we have more disease than we've ever had. To me, that says one thing: system doesn't work. So I would never want to repeat that system in the people that come to see me. We're the opposite of medicine, if that makes sense. Okay. Harry's saying thank you. You're welcome, Harry. Glad I could help. Glad I could help your friend. Sharon, can you recommend any good textbooks to learn more about vitamins and minerals and what each does for the body? Depends. Yeah, I can recommend a lot of books. If you see the shelf behind me, this is one of many bookshelves full of medical texts and biochemical and other forms of textbooks that I have. It depends on your level of education. Fundamentally speaking, there are a lot of different books on the topic of nutrition. Unfortunately, many of them are written from the stance of opinions. And there's nothing wrong with opinion. I think ultimately everybody has an opinion. You go to the doctor, you get a second opinion, right? But if you're looking for science, which I'm a man, I like hard science. And I know even with science, there's still questions. Science isn't perfect, and we're always asking the next question. So if you've got a good degree in biochemistry or good background in biochemistry, physiology, pathophysiology, histology, in the basic fundamental biology sciences, actually I can pull the one that I love the most right here. I've got a couple of good ones that I like to turn to, and happy to share them with you. The first one is My Nutrition Bible, so to speak. This is a really great book on authoritative nutrition. It's called Modern Nutrition in Health and Disease. And you can see it's quite thick, and it's not thick with pictures. It's thick. It's very, very heavy reading. So again, if you don't have that scientific background, it's probably not going to be the best book for you because it'd be hard to digest. Another one, and this is a little less scientific, but it's still quite scientific, and it's nutritional biochemistry. You can see, again, it's quite thick, not with pictures so much as it is with science and text. So those ones are really solid as far as if you really want to dive into it deep. But the best place, if you want to learn about vitamins and minerals, check out my videos. All the whiteboard videos, you go back through my channel and watch all my whiteboard videos. And we're actually getting ready to launch a whole bunch of new ones. So stay tuned for those, because I do those on purpose. I want everybody to learn about, why is it important? What does magnesium do? What does zinc do? What does calcium do? Go watch my whiteboard videos and you'll see them. It's me with a little whiteboard behind me, or a big wall now that I have this big wall that's a whiteboard so that I can draw and teach about vitamins and minerals. So go watch the ones that we have up, and you can find those on the Glutenology YouTube channel. So go to Glutenology, or go to youtube.com/Glutenology, and you can find those whiteboard videos. It's a great place to go learn about what they do. Okay. I have double MTHFR mutations and optic neuritis. I like that you are opposite of medicine. Oh, well, thanks. Double MTHFR mutations and optic neuritis. I can give you a little bit on MTHFR. MTHFR, for those of you watching that don't know what it is, it's methyl tetrahydrofolate reductase. It's a gene that helps us to methylate folate, which is folate is a B vitamin, typically referred to sometimes as B9, sometimes referred to as folic acid, but folate is what it actually is. And a mutation in that MTHFR gene can reduce a person's capacity to methylate folate, which can lead to neurological damage, vascular damage. It can lead to detoxification problems, because methylation is a central core theme that the body uses to help to detoxify. So making sure, Carla, that you're getting ample quantities of green leafy vegetables in your diet is very important for you. Some people don't need quite as much, but if you've got MTHFR mutations, you need more of the green leafies. So spinach and chard and kale are all going to be important. Green leaf lettuce, Bibb lettuce, anything that's green and leafy, including the cruciferous greens, the cabbage, the broccoli, those are all going to be great sources of natural folate for you to help you to accommodate for that gene mutation. Now, the other thing you can do is you can take a form of methylated folate. The one I recommend is 5-MTHF. you can pick that up as well on glutenfreesociety.org. It's a form of premethylated folate for those of you who have that type of mutation. Okay, good input. Kayla, my head hurts literally. I hope that just means you're getting full of information, and so your head is swelling with knowledge, and that's why it hurts. I hope your head's not actually hurting. Okay. Well, I think I took all the questions. We've gone a little bit past time today, but I wanted to make sure we got all the questions answered. So today I'm giving away a free bottle of Ultra Nutrients, which is my premium gluten-free multi-mineral multivitamin formula. Our big winner today is actually Kayla. Kayla, your head hurts literally. Well, we're going to ship you a free bottle of Ultra Nutrients. My team is going to be reaching out to you through Facebook and getting you taken care of. So Kayla was the one that actually played by the rules. She shared our last video feed, and she sent us the image of that share. Now we're going to change the rules for next week because again, I want to make sure that everybody can play, and I want to make it easier. I want to make the rules a little bit easier. So what I'm going to ask you to do with this video is I want you to share it. I want you to share it with every Facebook group who you think might be benefited by it. I want you to share it with family and friends. But in the share line, when you're typing in text, I want you to type in #ImmuneHealth. #ImmuneHealth. So if you use #ImmuneHealth, we're going to be able to track who shares the most via our search engine. And again, the biggest winners are the ones who share the most. So thanks so much for being here with me today on Pick Dr. Osborne's Brain. We will see you next week, same time, 1:30 Central Standard Time. Have a great weekend.